The American Cancer Society estimates that in Texas, 139,000 cancers will be diagnosed this year. We know despite many advances in cancer care, which we think is about a 30% improvement in cancer mortality in the last 30 years, that minority cancer patients have a disproportionate burden of morbidity and mortality related to cancer.
Minorities have been a little bit behind in terms of screening for different types of cancers, and I have to emphasize how important it is for everybody, minority or not, to do their proper screening.
If we can get those patients screened, then we can maybe detect cancer early, or maybe even more importantly, prevent cancer.
There are things that we can do about that here in Texas, and that's why it's so important to heighten awareness for Minority Cancer Awareness Month.
Things we have tried doing to improve the outcomes in minority patients would include giving speeches at community centers, churches, any local community outreach, which I have been doing for many years, making patients aware not only of cancer once it's diagnosed, but also screening and prevention of cancer, which in my opinion is even more important than actually treating it once it's diagnosed.
Clinical research is extremely important to our organization because it's how we forward cancer care.
Most minorities don't really don't trust the healthcare industry because of some trials that were done in the past. All those unethical trials that were done in the past don't exist anymore, but some minorities don't know that, so they don't really have faith in the healthcare industry. So it's very important for us to let them know that things are much better. They need to come in for enroll in clinical trials, also for testing.
There are now many studies that have shown that if minority populations are offered an opportunity to participate in clinical trials, they will most likely enroll. And so it's up to us as oncologists to really reach out to those patients, educate them, and offer them a trial spot.
We do know that in Texas we have real challenges among uninsured populations.
Insurance or lack of insurance is a big factor because being underinsured or without insurance prevents them from seeking preventative care.
I have found, being an oncologist over the years, that direct cancer outcomes are directly related and correlated to access to care.
Our communities have different needs, and certainly we do not want to leave anyone behind when we're trying to fight cancer.
We're a group of over 500 physicians and 6,000 team members that are a diverse group. We look like you, we speak many of the same languages, and we believe that it's important to be able to connect with our patients, to engage with our patients.
We share their same goals, and we wish to empower them with understanding how we can care for them, how we want to improve access, and we will get them where they need to go, which is the best healthcare possible.
We are excited to work with you on these efforts so we can continue to improve the health of all Texans.